Hi, happy hump day on this special Wednesday. For those who don't know me, I am Dr. Heather Stanley, the pregnancy specialist, and we're going to spend a few minutes today talking about your first prenatal visit and you're pregnant and you have polycystic ovarian syndrome. As we talked about last week, there are special considerations for having this condition coincident with a pregnancy. And so, in addition to the usual prenatal routine surveillance and evaluation, there are a couple extra things that need to be added to the care plan to minimize complications. So you're at your doctor's office, you're probably having your intake, your first visit, and you're filling out a bunch of paperwork with your medical history and family history, social history. One of the things I would like for you to be particularly mindful of is to make sure that you write PCOS in bold, and make sure that when the intake nurse or the doctor is talking to you, you bring this to the forefront of all of the other things that are going on. You may have hypertension, you may have diabetes, and those are important considerations. However, PCOS should not be overshadowed with the other things that are going on. So with PCOS, if you don't have diabetes or if you have insulin resistance without the full diagnosis of PCOS, questions to ask is, how early do we start evaluation for conversion to gestational diabetes in the pregnancy? It's never too early to start. If you're in your first trimester, getting a baseline set of labs, doing a baseline evaluation to make sure that you're not pre-diabetic or even early diabetic in the pregnancy. So there are specific labs to be added to the routine prenatal labs. Number two, monitoring your blood pressures. PCOS does increase the risk of gestational hypertension and preeclampsia, even with first pregnancies. So discussing what would be a care plan to look at that usually tends to happen in 20 weeks. So maybe for the first prenatal care visits, it may not be too much of an issue unless your blood pressures have been noted to be elevated at the first few visits. Also something to have a care plan discussion with your provider. Now, something that's we should also talk about is cervical insufficiency. So cervical insufficiency is another entity by itself. However, if you have a history of cervical insufficiency and you have PCOS or insulin resistance, there have been studies, latest study back in 2016, that shows that with the diagnosis of history of cervical insufficiency and PCOS or insulin resistance, the cervical insufficiency tends to occur earlier in the pregnancy and the outcomes tend to be way worse. So for our ladies who have a history of cervical insufficiency and PCOS or cervical insufficiency and insulin resistance, assessment of the cervix is going to be a critical important, and the timing of the cervical length assessment. So that too needs to come into play with the obstetrical history with your OB doctor as to how that is going to be managed prospectively. This is Dr. Heather Stanley Christian. I want to wish you a wonderful day. Have a great day. Don't forget to breathe, walk good, and enjoy today, because I know I will be. You can find us at in Unity MFM, we do provide individualized care. We look very well into your history and would recommend a care of plan for you. So if this interests you, please come check us out. Happy to do some consultations, and peace.